So Jackson came back. This is his second day. And so I thought we would ask him how he feels. And I thought I would then demonstrate that the mobility is presumably still restored. So tell us how you did walking, sitting, what's different in your low back.
Yeah, so I would say after the treatment, yesterday I spent a good amount of time walking around, and the best way I can describe it is in the sacral area and below, I felt more fluid in terms of motion, so it felt like I was moving, more fluidly and easily than I had beforehand. Previously I think I would notice a little bit of guarding or tightness in that low back area, and it seemed like throughout the day yesterday and this morning that I felt better or moved better.
Nice. And how was sitting?
Yeah, so sitting, I went to dinner last night and sat. I rode in the car for maybe 45 minutes sitting. And I would say my pain was lower than it had been. If it was a 4 or a 5 before, maybe it was more of a 1 to 2, more of an awareness discomfort.
Nice.
So seemed to be definitely improved. So we'll hope that continues with that.
Nice. And you will not need me to treat you again. So today my job is to teach you how to keep those motions, and that's very, very straightforward. Just a few simple things that you do that'll take you 10 minutes.
Yeah, that sounds great.
And you'll do them every day for a week, but then you'll do them twice a week thereafter.
Right.
And that will keep that mobility. So you'll be independent of healthcare practitioners.
Yeah, that would be great. That would be great. So I'm looking forward to that.
Good. Lie on your stomach and we'll show the mobility. So I noticed yesterday, and I think we filmed it yesterday, that the symmetry did improve, okay, but it did not equalize, okay? And we showed that that's a developmental issue, and you have very good mobility here, and you have it here, okay? And then you're going to have it here as well, and this way also, okay? And the tailbone, you'll never need to have that straightened out. It's straight today. And then the other issue is the sacrum and L5. Okay, so here's the PSISs. So that puts us at S2. That makes this S1. So I'm testing forward bending. Took up the slack. It moved and it came to an end point. That was absent yesterday. And now I'm going to spring it. And I can spring it forward. I thrust it forward and it springs right back with integrity. And L5 was also blocked. And L5 is moving nicely. So yeah, I'm very pleased with your response to this. And just a reminder from that second video, we showed that when you sit a little bit asymmetrical because of the pelvis. So then the chair forces you into a false sense of it tries to force you into symmetry.
Right.
But you're not made that way.
Right.
So sitting on a 1/4 inch lift of craft foam under the right sit bone was very helpful. And the other thing we found yesterday is that you had limited traction. You had no traction mobility when your neck was extended at 10 degrees.
Right.
And that was isolating the upper 2 joints in the neck.
Yeah.
And we found that released. That was a muscular nervous system phenomenon reflexively driven by the sacrum being stuck. So one lock in the sacrum unlocked the upper cervical.
Yeah.
So great case study. Thank you very much.